Hello everyone, I am Dr. Geeta Hegde and today we will be learning about peptic ulcers. Peptic ulcers are also known as acid peptic disease. Now this question is usually asked as part of a case-based question or a case-based scenario question. So let us learn about peptic ulcers. Now what is peptic ulcers? A peptic ulcer is an ulcer. Now the ulcer, what is ulcer? Ulcer is an erosion of mucosa of the alimentary tract or GI tract which extends through the muscularis mucosa into the submucosa or a deeper layer. I'll repeat again. Peptic ulcer. Ulcer is the erosion of mucosa of the alimentary tract or GIT which extends through the muscularis mucosa layer into the submucosa or even deeper. Now, it is known as localized erosion and destruction of either the gastric or duodenal mucosa. This is known as peptic ulcer. Now, what are the causes of these peptic ulcers? The main causes of peptic ulcers are here HCl and pepsin. These are the two main causes which are involved in genesis of peptic ulcers. Hence, it is known as acid peptic disease. So, peptic ulcer also known as acid peptic disease. Why is it known as acid peptic disease? Because HCl and pepsin, these two are involved in genesis of peptic ulcer. Now, gastric mucosa or duodenal mucosa may be damaged due to increased production of either HCl or acid or pepsin or both, which leads to formation of the ulcers. Now, depending on the location of the ulcer, whether it is in the duodenum or the stomach, it can be called as duodenal ulcer. If it is in the stomach, it will be known as gastric ulcer respectively. Okay. Now, what are the causes of peptic ulcers? The commonest cause of peptic ulcer is disruption of the mucosal barrier. Second cause is hypersecretion of acid and pepsin. Third cause is delayed emptying, which is seen in pyloric stenosis, and the fourth other cause is infection by Helicobacter pylori. So let us look at the causes. Now, peptic ulcer itself is defined as localized erosion or destruction of either the gastric or duodenal mucosa. First common cause is disruption of mucosal barrier. Now, why does disruption of mucosal barrier happen? This can either happen due to excessive consumption of steroidal or non-steroidal anti-inflammatory drugs. These are usually painkillers or pain medications. This can lead to disruption of the mucosal barrier. Second cause of disruption of mucosal barrier is excessive alcohol consumption. Third, it might be because of bile salt regurgitation. Okay, so these are the causes which are responsible for disruption of the mucosal barrier. Disruption of mucosal barrier, I will repeat again, ingestion of either steroidal or non-steroidal anti-inflammatory drugs. These are mainly painkillers. Second, excessive alcoholic consumption. Third, bile salt regurgitation. Now here we see the second cause is hypersecretion of acid or pepsin. As we said earlier, it is known as acid peptic disease. Now, ingestion of food which causes hypersecretion of either acid and pepsin. Now, whenever a person is having oily, spicy food, these spices and condiments lead to hypersecretion of acid. Okay, second cause is increased secretion of gastrin, which can be seen in Zollinger-Ellison syndrome. We'll have a look at Zollinger-Ellison syndrome towards the end of the video. And the third cause of excessive or hypersecretion of acid and peptin is chronic stress and anxiety. Third cause is delayed emptying, which may be seen in cases like pyloric stenosis. The fourth cause of peptic ulcer is infection by H. pylori. Other name is Helicobacter pylori. Now, what does this Helicobacter infection do? Helicobacter pylori infection causes gastritis. And this gastritis is usually followed by peptic ulcer. So, I will repeat again. Peptic ulcer, the commonest cause is disruption of the mucosal barrier. Second cause is hypersecretion of acid and pepsin. Hence, it is known as acid peptic disease. Third is delayed emptying, which may be seen in pyloric stenosis. And fourth commonest cause is Helicobacter pylori. Now let us have a look at the clinical features. The most common clinical feature of a stomach ulcer is severe burning pain in the epigastric region. Severe burning pain in the epigastric region immediately after food intake is seen in gastric ulcer patients. Now, if the location of the peptic ulcer is in the duodenal region, or if the patient is suffering from duodenal ulcer, then this severe burning pain will be felt 1 to 2 hours after food intake. Another clinical feature is nausea and vomiting which may be present. Now, heartburn. Heartburn is also one common clinical feature. Now, why does heartburn happen? Heartburn is due to regurgitation of acid into the esophagus. So, this is known as gastroesophageal reflux disease. In simple words, GERD. Another common clinical feature which may be seen here is hematemesis. That means vomiting of blood. Hemat is blood and emesis is vomiting, which may be seen in cases of bleeding ulcers. Last, anorexia, loss of appetite and loss of weight which are seen. So, I will repeat again the clinical features. The highlight of clinical feature is severe burning pain in the epigastric region. If it is a gastric ulcer, the patient will have immediate pain immediately after food intake, and if it is a duodenal ulcer, severe pain will be felt 1 to 2 hours after food intake. Another common feature which is associated is heartburn, which is due to regurgitation of acid into the esophagus, known as gastroesophageal reflux disease or GERD, GERD. Nausea, vomiting may also be present. Hematemesis may be present in case of bleeding ulcers. Belching, excessive gas formation, these are also features which are associated with stomach ulcer. And last but not the least, anorexia and loss of weight are always present. Now, how do we prevent peptic ulcers? Prevention of peptic ulcers can be done by having adequate quantity of water which can be taken regularly. Second, avoiding ingestion of excessive amount of spices, because spices lead to hypersecretion of acid and pepsin. So, this may aggravate the peptic ulcer. So, avoiding ingestion of excessive amount of spices, avoiding ingestion of oily, spicy food. Third, avoiding ingestion of gastric stimulants. Now, what are gastric stimulants? Substances like alcohol, smoking, tobacco, excessive caffeine intake, which may lead to increased acidity. And last, regularity in meals and sleep. Let us have a look at the medical management of peptic ulcers. Now, there are various methods which are employed for management of peptic ulcers. Now, these methods are usually aimed at either decreasing or inhibiting the acid secretion. Second, enhancing the mucosal resistance to acid. So, the various products which are commonly used, one is antacid. So, what you see here is an antacid. What does an antacid contain? Antacid contains aluminium hydroxide, magnesium hydroxide or calcium carbonate. They form a gel that neutralizes the acid. The antacids are the first mode of treatment. These antacids contain aluminium hydroxide, magnesium hydroxide or calcium carbonate. They form a gel that neutralizes the acid. The second is anxiolytic drugs, yoga, meditation. They all relieve stress and thereby reduce the production of acid. Third is H2 receptor blockers. Now, what are H2 receptor blockers? These are histamine receptor blockers. Now, what these drugs block the effect of histamine on acid secretion. Okay, so what are the various types of H2 receptor blocker drugs? Drugs like cimetidine and ranitidine. They are known as histamine receptor blockers, which block the effect of histamine on acid secretion. The next is proton pump inhibitors or proton pump blockers. Now, what are these drugs? These drugs block the HCl secretion. How do they block the HCl or acid secretion? By blocking the hydrogen potassium ATPase pump. Now, whenever the hydrogen potassium ATPase pump is blocked, less amount of HCl secretion happens. These group of drugs are known as proton pump inhibitors, PPI, or proton pump blockers. Commonest drug which is used here is omeprazole. Okay. Then medical management of peptic ulcer. Usually it is the management or treatment of Helicobacter pylori infection with the help of antibiotics. Okay, so in H. pylori infection, antacids are given which envelop the gastric mucosa, reduce the acidity. Antibiotics will help in treatment of the infection. Proton pump inhibitors like omeprazole will be given to decrease the amount of HCl secretion, and H2 receptor blockers, which are histamine receptor blockers like ranitidine or cimetidine, is also given along with it. So these drugs are usually given for a drug therapy for around 3 weeks for management of H. pylori infection. Another drug which is used is sucralfate. Now what is sucralfate? Sucralfate is an aluminium salt of sucrose octasulfate. Sucralfate, sucrose octasulfate, the aluminium salt of sucrose octasulfate. What does this do? This adheres to the surface at the ulcer site and increases the resistance of mucosa to acid. Okay, so these are also given. So the various modes of medical management of peptic ulcers are antacids, then yoga, meditation, which may reduce stress. Third is histamine receptor blockers or H2 receptor blockers like ranitidine, cimetidine. Fourth is proton pump inhibitors or proton pump blockers, drugs like omeprazole, which block the hydrogen potassium ATPase pump. Fifth, antibiotics are usually given with H2 receptor blockers and proton pump inhibitors so as to treat the H. pylori infection, and antibiotics are given. Last, surgical management when the medical treatment does not control the disease. So the various forms of surgical management are vagotomy plus antrectomy, which is resection of the antrum, vagotomy plus pyloroplasty, where there is resection and dilatation of the pyloric canal, vagotomy, which is cutting of vagus, with gastrojejunostomy, where the stomach is connected with jejunum along with vagotomy. So these are the treatments which are given if the patient is not responding to the medical line of treatment. Last is Zollinger-Ellison syndrome. Now what is Zollinger-Ellison syndrome? This is a syndrome which is caused by excessive secretion of gastrin by tumors which are known as gastrinomas. So gastrin secreting tumors are known as gastrinomas. These gastrinomas are usually non-beta cell pancreatic tumors, and in these conditions there is excessive HCl secretion, hence the patient may develop peptic ulcers. Thank you.